Alright, so recently I just put up a blog about shoulder impingement. What shoulder impingement is, and the kind of term gets kind of thrown around quite a bit. There isn't just one type of shoulder impingement, there's many different kinds. So kind of a vague term is that whenever our humerus is running into the structures of the rotator cuff in between the acromion and the humerus. So whenever this is happening, we're getting a little bit of irritation on the cuff. So what we can do is we can do a few provocative tests in order to see how bad the impingement is. So everybody has some sort of impingement. So it's just a matter of the excess of the impingement. So the few tests that we're going to do is a Neer's test, I believe it's a Hopkins test. It could be something else, so I apologize if it is. And then we're going to do another one for internal impingement. So what we're going to do is, all we're doing, for the first one, we're going to do access range of motion. So what I have somebody do is have their arms at their side, and I just have them take their arms straight over the top of their shoulder. So Katie, can you just take your arms right over the shoulder? Okay, now, and I'll ask, do you feel a pinch anywhere on top of the shoulder? So that would be a no, so that would be a negative test. So that's not as provocative. This is more of a provocative test. It's called the Neer's test. So what I'm going to do is I'm going to hold down the shoulder blade or scapula. I'm going to internally rotate the arm, keep the scapular down, and then raise the arm up. So this is more provocative and more chance of impingement. So do you feel any pinch on top of the shoulder?
No, not really.
So that's maybe a maybe. So, like I said, these tests are provocative, so you might get a little bit of pinching. So sometimes, even if it's not on the surface, it might be an underlying issue and it hasn't come to the surface yet. So if I do the other one, I hold down the shoulder blade, I internally rotate, and then I lift the arm. So do you feel pinch at the top?
A little more, yeah.
So a little more. So maybe she has a little bit of impingement. So if we have impingement on and we feel in the top part of the shoulder, that's going to be subacromial impingement, which is just going to be basically underneath the acromion, which most of your normal lifting population will have a case of. So another one is our Hopkins test. So what we're going to do is we're going to take the arm, we're just going to take it out to 90 degrees. We're going to take it on the scapular plane first, we're going to bend the elbow, and then we're just going to bring into a little bit of internal rotation. So do you feel anything? No? And for this one's more towards coracomial impingement. So the impingement would be more or less happening in the front part of the shoulder rather than the top. So then we just kind of get a little bit more provocative as we go, and then I go back in the internal rotation. Anything? No? And then across, a little bit more provocative, internal rotation. Anything? So she's going to have a slight little impingement. So the difference is, between those two is maybe if I have the overhead one, I may not want to do stretches over the head. I may not want to bring my arm overhead because that's actually causing the irritation of the cuff. If I am going across body and I'm getting this little pinch, I don't maybe want to stretch my arm across. So those are the first two. The next one is external impingement. So
this is where I actually mean internal impingement and not external impingement. So I might say it a few times, but it's testing for internal impingement, not external.
With this type of impingement, this is going to be more towards your overhead athlete population. So whenever we have this external impingement, it's going to be more, like I said, baseball players, volleyball players, people that are going to go in excess of external rotation. So when I do this one, I'm going to bend the elbow. I'm going to bring to the scapular plane. So I don't want the arm here, and all I'm going to do is internal rotation. We're going to go to external rotation. So here, and I'm just going to bring her in external rotation. So if she feels a pinch in the back part of the shoulder, and she actually has quite a bit of external rotation, that would be internal impingement. So kind of what's happening real quick is with the first two, the humerus is kind of banging up against the top of the acromion, causing impingement on the rotator cuff. On this one, whenever we are going in external rotation, her humeral head is shifting anteriorly up, causing a little bit of impingement in the back of the shoulder. So that's kind of a quick overview. Hopefully it's quick on impingement. So it could be soft tissue work. It could be the rotator cuff is a little bit irritated, causing a little bit of fraying. So remember, the job of the rotator cuff is kind of to keep the ball and socket in line. Whenever these things aren't working together, it's moving, the humeral head is moving around, that's when we're going to cause a little bit of irritation, and that's when problems can happen. So thank you very much, Katie, for helping me out. Thank you. Bye.